Nashira, I think Mrs. Fatiha has developed some rashes and itching after 50 minutes of blood transfusion. This is the patient's baseline vitals before the transfusion. Her blood pressure is 120 over 80, pulse rate is 80, respiratory rate is 60 breaths per minute, and oxygen saturation 98% on room air.
Noted what the current water sign after blood transfusion?
The current, okay, this one. So blood pressure has dropped to 90 over 60. Pulse increased to 115. Respiratory rate 22 breaths per minute with mild wheezing. Oxygen saturation decreased to 93% on room air.
This is might be indicate allergic transfusion. Please stop the blood transfusion immediately and switch to normal line.
Okay, noted. Nashira, I already stopped the transfusion and switched to the normal line as you said. Have you called the doctor to inform them about it?
Not yet. I will call the doctor after informing the. Please monitor blood transfusion closely.
Okay.
Tidak have a urgent thing happen to Mrs. Fatiha. She showed allergic reaction after transfusion. After 50 minutes, she has no history blood transfusion before. Her baseline vital sign before 120 over 80. Pulse rate is 80, respiration rate 60, SpO2 98%. However, current vital signs show 90 over 60, as 115, respiration rate 22, with wheezing and 93.
Oh, what are the intervention
Stop the blood transfusion and open to normal line. And also, Mr. Nesapron 1 liter if the SpO2 under 90%. Nurse Farah will collect the blood sample. We need to call medical team immediately. Can you return the sample to the blood bank?
Sure, I will monitor her response and I will ask Ms. Farah to do lab tests and we will try to find a new IV line for maintenance.
I will call the result to inform about it. As a result, I am Nashira from I1 in charge patient. This is around 40 years old. Female is received the blood transfusion. The patient developed rash, face swelling, and itching after starting transfusion. Patient has no history of the allergic reaction of the blood transfusion. Baseline vital sign before transfusion 180, heart rate is 80, respiration rate 60, SpO2 98. Current vital sign 90 over 16, heart rate 150, respiration rate 22 with wheezing, and also SpO2 is 93. I suggest starting IV antihistamine and also prepare oxygen equipment as precaution. I also request order for IV fluid of the hypotension, corticosteroid if the symptom worsen. I ask for team member to close monitoring the patient and also request the send sample to the blood bank for the future testing. Turn the blood to the blood bank. Also monitor Mrs. Fatiha closely. Thank you, doctor.
Ms. Shakira, I will notify the blood bank to update Mrs. Fatiha conditions after the blood transfusion reactions and I will return the blood. Please document properly. These highlight the importance of floor clarity, anticipation of care needs, and readiness to initiate rapid treatment in transfusion reactions, and regular ISBAR communication practice to reinforce skills and teamwork.
Using ISBAR with suggested recommendation made escalation precise and efficient. Thorough documentation and timely allergic status update also play a crucial role.
Early recognition, immediate stop blood transfusion and proposing treatment steps help stabilize the patient quickly. So continuous patient monitoring during transfusion remains essential for safety. Mrs. Allen, you look flushed and your face is swollen. Do you feel itchy or shortness of breath?
As it itchy and my chest feel tight.
Nezati, could you please help me take a vital sign on this patient?
Sure.
Nezati, have you taken the vital sign on my patient?
Yes. Blood pressure is 100/65.
Okay.
Pulse 120.
Mm-mm.
Respiratory rate 24 with mild wheezing. Oxygen saturation 95% on there.
Oh, I see. So we started cefuroxime intravenous about an hour ago, right?
Yes.
I see. Given the rash and swelling, I think this could be an allergic reaction, right? Zati, could you please help me stop the cefuroxime IV now?
Sure.
Okay, thank you. Zati, could you please monitor my patient while I talk to team leader Shira?
Sure can.
Okay. Team leader Shira, I think my patient has allergic reaction because her face look flushed and her face is swollen. And then I already take her vital sign. Blood pressure is 100/65, pulse 110, respiratory rate 24 with mild wheezing, and oxygen saturation is 95% on the room air. Should I call the doctor first?
Yes, you need to call the doctor immediately before starting any new treatment.
Okay, thank you. Hello Dr. Azim, I'm Nurse Farah, nurse from Ward 6B. So basically this is about the patient is named Mrs. Allen, 42 years old, post-embeddectomy. So started on IV cefuroxime about an hour ago. However, I realized that she developed generalized rash, facial swelling and itching after started cefuroxime IV. No prior drug allergies documented. So her vital sign is 165/65 on blood pressure, heart rate 110 regular, and then respiratory rate is 24 with wheezing. SpO2 is 95% on room air. So cefuroxime IV has already stopped. So the patient has mild respiratory distress, raised heart rate, and stable oxygen saturation on room air. So we are seeking urgent review and instruction for further management, including whether to start oxygen or maybe allergic medication. Understood, doctor. We will monitor closely and wait for you. Thank you.
Have you called the doctor?
Yes, I already informed the doctor.
Now I will add you to not notify pharmacy immediately to update Mr. Allergy status and ensure cefuroxime are not given again.
Okay, thank you, Leader Shira.
Welcome. Having defined role made the process smooth, Nurse Sarah could concentrate on the call while I focus on the patient care and closely monitoring the patient condition. This collaborative approach enhances our overall workflow, minimize error and ensure timely and appropriate patient management.
ISBAR help us communicate clearly and systematically. By following this structured approach, we were able to ensure that all critical information was conveyed accurately and efficiently, minimizing the risk of overlooking essential details. Furthermore, preventing the initiation of any treatments without appropriate medical orders or authorization.
As a team member, having defined role made the process smooth. Nurse Farah could concentrate on the call while I focus on the patient's care and closely monitor the patient's conditions. This collaboration approach enhances overall workflow, minimizes errors, and ensures timely and appropriate patient management.
That's the day I concerned about Mr. Dow in bed 5. His wife are training poorly and she look unwell.
Oh, what are you seeing? Let's run through that.
His BP is 95/60, a drop from his baseline. Heart rate is 150 and she breathing fast at 24 breaths per minute. His temperature is 38 degrees Celsius. Most critically, his skin clammy and she is showing noticeable change in mental status. She is easily alert but seem drowsy now. I suspect early septic shock. You can see.
Heart rate 150.
Yes.
Respiratory 24, hypertension, and no mental status change. Let's meet early sepsis criteria. Let's act immediately. Get him on high flow mask, and I'll give him 250 milliliter sweat challenge, and I'll notify the team leader immediately. Okay?
I understood. Oxygen on and start lab request on the way.
Okay, thank you. Leader Farah, we have urgent situation with Mr. Dawood. He is having early sign of septic shock and hyperperfusion.
What intervention are in place?
For now, oxygen is on 10 liter via non-breather, and I have
Okay.
started an initial 250 ml bolus of normal saline. And Nurse Shira will collect blood cultures and lactate samples. We need to call the medical team immediately.
Alright then, I will stay with Mr. Dao and monitor his response. Okay?
Okay, and I'll call the doctor to tell Mr. Daw's conditions.
Okay, that's good.
Assalamualaikum Dr. Ahmad. This is the in-charge nurse on IM1. I'm calling about Mr. Daw bed 5, 1 day post-op abdominoplasty. Mr. Daw 78 admitted for acute abdominal pain on 7th June at 7:30 p.m. He is showing signs of early septic shock. His condition is rapidly deteriorating. He was stable this morning, but his current vital signs are BP 95/60, heart rate 150, respiratory 24, temperature 38.2 degrees Celsius. He has a new onset of drowsiness and clammy skin. My team has initiated 10 liter oxygen, started 250 ml normal saline bolus, and we think that blood culture and lactate will be needed. Suspected septic shock. Could you please attend the ward immediately to review him? Thank you, Doctor.
During reflection, team member quickly identify the cluster of the concerning sign, such as tachycardia, tachypnea, hypotension, and mental status change, triggering the necessary escalation.
The team leader immediately assists her colleague to improve patient condition, establishing good teamwork cooperation.
Actually, structured communications hold a vital role in escalating crucial information. In this scenario, the in-charge use the ISBAR framework precisely, ensuring the medical team receive a clear, conscious, and structured handover of the critical information leading to prompt management.